Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 20-year-old man presents with acute gingivitis associated with oral ulceration. A diagnosis of primary herpes simplex infection is suspected. Which one of the following types of rash is he most likely to develop? A. Erythema abiegner, Erythema nodosum, C. Erythema chronicum migrans, D. Erythema marginatum, E. Erythema multiforme. Okay, this question is asking about the type of erythema in this patient. Our patient is a 20-year-old man coming with acute gingivitis and oral ulceration with the diagnosis of primary herpes simplex. Okay, in herpes simplex infection we can see erythema multiforme lesions. The answer can be erythema multiforme. Explanation. Erythema multiforme is a hypersensitivity reaction that is most commonly triggered by infections. It may be divided into major and minor forms. Previously, it was thought that Stevens-Johnson syndrome was a severe form of erythema multiforme, but they now, however, consider separate entities. Features of erythema multiforme. Target lesions initially seen on the back of the hands and feet before spreading to the torso. The upper limbs are more commonly affected than the lower limbs. Pruritus is occasionally seen and is usually mild. Causes of erythema multiforme. Viruses as like as herpes simplex virus, as we can see in our patient primary herpes simplex virus infection. Herpes simplex virus is the most common cause. ORF, which is a skin disease of sheep and goats caused by parapox virus. It can be idiopathic. Bacteria like Mycoplasma and Streptococcus can also cause erythema multiforme. Drugs like penicillin, sulfonamides, carbamazepine, allopurinol, NSAIDs, oral contraceptive pill, nevirapine, and so on. Connective tissue disease, example, systemic lupus erythematosus. Sarcoidosis, malignancy can also cause erythema multiforme. Here we can see the lesions of erythema multiforme in the upper limbs of this patient. Their lesions pattern is a target-like lesions. Here we can see the urticarial lesions of erythema multiforme. Here we can see erythema multiforme in legs of this child. Here we can see also in the palm of a patient the target-like lesions of erythema multiforme. Erythema multiforme major. The major form involves not only the skin but also the mucous membranes and can be more severe than erythema multiforme minor. Here we can see the involvement of the patient with erythema multiforme. The involvement of mucous membrane, the mouth and the body, or a patient with the diagnosis of erythema multiforme. The management is usually we must manage the cause of the disease. It can be viral, it can be idiopathic, or it can be due to any malignancy or due to a drug. Here was a short explanation about erythema multiforme and presentation. Thank you for your attention.